Hi, CHW Hub. It's me, Nurse Sarah, coming to you today to talk a little bit about the new COVID-19 variants and the vaccination that's expected to roll out this fall. So as respiratory season approaches, it's important that we know what's going on with this virus and know what to expect so that we can educate our patients. So first, there are two descendants of the XBB variants that are growing quite rapidly. The first of which is called Eris. It's got a little code name EG.5.1. It doesn't appear to be any more dangerous than the previous variants. There's also Fornax, or FL.1.5.1, and it is the next largest strain. Both Eris and Fornax have a mutation on the spike protein, but so far there's no evidence that this has reduced vaccine effectiveness. If you recall from earlier updates that we've done and other education that we've done, the spike protein is the part of the COVID-19 virus that is used to infect our cells. And it's also the part of the virus that our immune system uses to identify the virus so that it can fight it. So a mutation to the spike protein is a big deal, which brings me to the third variant, BA.2.86. No fun name for that. It's just the code name. But it has only been tied to 7 cases of COVID worldwide as of me creating this video. But it does have several mutations, particularly in the spike protein that scientists are monitoring closely. Again, not too many cases of this variant yet, and it's still too early to know whether the mutations will affect vaccines or other forms of immunity. Or whether this variant is more contagious or leads to more severe disease than previous variants have. With that said, there is a new monovalent COVID-19 vaccine expected to roll out from Pfizer sometime in early October per the CDC. This vaccine will target the Omicron subvariant XBB.1.5. And even though this is not currently the most predominant variant in the United States, it is still expected to protect against severe disease and hospitalization. Moderna and Novavax are also working on vaccines to be rolled out this fall, though no dates have been projected. In clinical trials, the Moderna vaccine is shown to be effective against the Eris and Fornax variants. So they've been testing it with those strains of the virus. Insurance is expected to cover the cost of vaccines for most Americans. And the Biden administration also plans to launch a program offering free vaccines for people who are not insured or who are underinsured. Side effects of the new monovalent vaccine are similar to previous vaccines, and they may vary from person to person, but they could include pain or redness at the injection site, feeling tired, headache, low-grade fever, chills, and muscle or joint pain. In infants and young children, it could also include irritability and fussiness. For more information, I have included in the newsletter links to the World Health Organization, Centers for Disease Control and Prevention, and the US FDA so that you can read a little more on your own about the new variants and about the vaccine that's going to roll out. I encourage you to try and stay as up to date on this as possible, again, as we enter this respiratory season. So that's all for me. I hope that you all have a wonderful rest of your week and stay well.